Hi, I'm Mario from Cape Reporter. Let me tell you why South Africa, as well as many other nations, is facing a health crisis that could have far-reaching consequences, especially for the most vulnerable populations. This is not just another headline. It's a call to action for everyone who believes in the importance of global health and human rights. In January 2025, President Trump paused foreign aid, a decision that sent shockwaves through the global health community. This was followed by a drastic 90% cut to USAID contracts, leading to widespread staff layoffs and the closure of numerous programs that millions of people rely on. The impact of these cuts has been nothing short of catastrophic. The president also halted funding for programs dedicated to combating HIV/AIDS. This move has left many wondering about the future of global health initiatives and the lives they aim to save. The immediate effects were felt across the globe, but nowhere more acutely than in Africa. Offices that once buzzed with activity are now empty, and dedicated employees have been forced to leave their posts. The ripple effects of these decisions are being felt in communities that can least afford to lose support. UNAIDS, which has been a lifeline for many, is now struggling to continue its essential work. The program has been instrumental in providing treatment, education, and support to millions of people living with HIV/AIDS. Without this funding, the progress made over the years is at risk of being undone. These cuts have had a devastating impact on HIV/AIDS programs in Africa. Clinics that once provided life-saving treatments are now struggling to keep their doors open. Healthcare workers, who are often the first line of defense in these communities, are finding it increasingly difficult to do their jobs. Experts warn that in South Africa alone, 500,000 deaths are projected in the next 10 years due to these cuts. This is not just a statistic. These are real people from all colors and socioeconomic statuses, with families and futures that are now in jeopardy. The human cost of these funding cuts is immeasurable. Sub-Saharan Africa has 25 million people living with HIV, a staggering number that highlights the scale of the crisis. Programs like PEPFAR, which have been funded by the US, have made significant strides in combating the epidemic. Since 2003, PEPFAR has saved 26 million lives, a testament to what can be achieved with adequate support. But now, HIV prevention, testing, and treatment services have been disrupted. Clinics are running out of supplies and healthcare workers are overwhelmed. The progress that has been made over the years is at risk of being reversed, putting millions of lives in danger. In South Africa, 222,000 people, including 7,445 children, face treatment disruptions. These are not just numbers. They represent individuals who are now facing an uncertain future. The lack of treatment can lead to a resurgence of the epidemic, undoing years of hard work and progress. In Ivory Coast, 516 health facilities have closed, impacting 85% of people on HIV treatment. The closure of these facilities means that people who were once receiving regular care are now left without support. This is a dire situation that requires immediate attention and action. Botswana has seen the closure of an orphanage for children with HIV. These children, who are already vulnerable, now face an even more uncertain future. The loss of such essential services is a tragedy that cannot be ignored. These cuts have also halted a $45 million HIV vaccine trial in South Africa, Uganda, and Kenya. This trial was a beacon of hope for many, representing the possibility of a future free from HIV. The halt of this trial is a significant setback in the fight against the epidemic. Countries are scrambling to respond. Governments and organizations are working tirelessly to fill the gaps left by these funding cuts. However, the scale of the crisis is such that it requires a coordinated and sustained effort from the global community. South Africa launched a new HIV treatment campaign, aiming to mitigate the impact of the funding cuts. This campaign is a crucial step in ensuring that people continue to receive the care they need. However, it is just one part of a much larger puzzle. Nigeria allocated $3.3 million for treatment, a significant amount but still not enough to cover the shortfall. The efforts of individual countries are commendable, but the scale of the crisis requires a global response. Experts are urging the EU and private organizations like the Gates Foundation to fill the funding gap. The involvement of these entities is crucial in ensuring that the progress made over the years is not lost. Their support can make a significant difference in the lives of millions. Follow us for more on this crisis and how you can help. The situation is dire, but with collective effort and support we can make a difference. Stay informed, stay engaged, and let's work together to ensure a healthier future for all.